Busy day, you're on the go. You want answers, need to know. Quick and clear, a friendly sign. We're right here. Every time.
Done right, every time. Trust our scans to give you peace of mind. Done right, every time. Trust our scans to give you peace of mind. Jelly beans, hey!
Hi, I'm Lily.
I'm Dana.
And I am Vanessa.
And we are your hosts for the Jelly Beans TV. And welcome to the show. Today we have special guest stars, the Seagulls.
They'll be demonstrating a specific ultrasound procedure for us.
And by the end of the show, you will know how to scan the seagull sign.
I think this just in. The Seagulls have landed. Let's go check it out. Let's go. Hello, and thank you so much for having us today. We are the Seagulls, and before we get into the Seagull sign on the sonographic machine, first we want to take a look over at the whiteboard, just to give you an idea of what we're looking at. Now, what is the Seagull sign? I'm so happy you asked. No, it's not the eggs you ate this morning sprouting into a bird in your belly. No, it's actually just a really cute descriptor that we like to use when we're talking about the aorta, its branches, and the branches of its branches. So come on, let's go take a look.
Alright, let me show you what the seagull sign looks like. Oh, wait, wrong one. Over here. Ta-da!
Before we get into our visual demonstration, we'd like to go over a few basics over here on the whiteboard. Let's first start with the abdominal aorta, and it has its two branches, the SMA and the celiac trunk. But today we're only going to focus on the celiac trunk. The celiac trunk arises off of the anterior aspect of the abdominal aorta and splits into the hepatic and splenic arteries. This is what it looks like in sagittal, and this is what it looks like in transverse. You see? It's split.
Okay, so let's test your knowledge. Which way would the hepatic artery be transversing in the body? Hello? That's right, it's the right side. But why? Because your liver is on the right side, and hepatic supplied your liver with blood. What about the splenic artery? That's right, on the left side, because your spleen is on the left. Yay!
So once we find it in a sagittal scan plane, what are we going to do to get it in transverse? You turn on it?
Yes! Turn on it!
Well, now that we've turned on it, this is what we see.
You got the seagull sign!
Awesome. Now that you know what the Seagull sign is, how to obtain it, and everything, you're ready for your visual demonstration. We'll be right back with you after this commercial break.
Introducing the future of comfort. The Jelly Bean Warmer 3000 not only holds one bottle of gel, not two, but 3 full bottles so that you never have to deal with cold gel again. Say goodbye to this, and say hello to this. Warm Gel, where comfort meets care. Call 1-800-GEL-BEANS to place your order today.
We're back. Psst, we're back.
We're back?
Yep.
Hello, welcome back. Seagull 2 and 3 have actually set up the visual demonstration for you guys. So they're just going to be going over what to do, what not to do with your patient, and also some knobology. So why don't you head over there and I'll meet you there.
Alrighty, and we are back. We are going to be showing you a visual demonstration of the do's and don'ts when performing an exam.
What not to do? Don't just walk in the room and start scanning. What you have to do is verify patient name and date of birth and why they are here.
Hi, my name is Dana. I'll be doing your ultrasound today. Can I please verify your name and date of birth?
My name is Siegel Ostrom. My date of birth is 111.
What not to do? Don't apply gel on the patient. What you want to do is apply gel to the probe and then on the patient. What not to do? Ignore patient's comfort. Don't continue. What you need to do is stop the exam when the patient is uncomfortable.
Oh, that hurts. I'm sorry, we can finish this test at a later date.
What not to do is give diagnosis.
How does it look?
Oh, girl, your aorta is blocked. Ain't nothing getting through there.
What you want to do is
How does it
not.
look?
When the doctor reads the results, he'll be in touch with you.
Now let's take a brief look at the sonographic machine to see what knobs we should be utilizing to optimize our image.
So we're looking at the aorta, and we want to find the branches of the celiac trunk and the SMA. Once we find that image, we're going to turn into transverse. Caw-caw! To optimize the picture, you want to make sure that you have an appropriate overall gain. You don't want it too dark, and you don't want it too light either. You can also adjust your TGCs, which affect different parts and levels of your picture. So you can highlight the area. You can also increase your focus, which is this line here, which clears the area that you want. And you can also increase and decrease your depth, this toggle here, which can adjust your space. We can also add Doppler to our Seagull to ensure that there is proper blood flow.
Okay, so looking at the time, there's a deal going on at Tiki Joe's, something with French fries. We gotta head out, us Seagulls, but I really hope you enjoyed these demonstrations. I hope you understand what we're talking about, and I can't wait to see you find the Seagull sign next. Thank you so much, and have a great night.
Previously on Doppler Divas.
What is in the Mickey sign?
I don't know. You were supposed to know this. We have our test tomorrow.
Right.
No, that you're wrong.
Tell me what it is then. Or tell me what it is. The Mickey sign is the hepatic artery, the portal vein, and what else?
The CBD. I cannot believe Joe last week with the Mickey sign. He was acting insane.
I know, he was being ridiculous.
I know. Today we have to do the portal vein. Like, we're screwed. Oh my god, he's coming.
Oh no.
What's going on? Why is everyone acting weird towards me?
Because you were acting crazy last week.
It was so uncalled for, like, nobody cares.
Right. Okay, but today we have to do the portal vein, so let's go.
I'm ready. You're the one
Well,
acting
you don't
crazy.
know how to scan that.
That's
so.
true. All right, we need to lock in for this.
I know, so we're going to assign the roles. You're already on the bed, so why don't you be the patient?
Okay.
Taylor, you could scan. I'll just... Patient care is an integral part of any ultrasound exam. So some key points are to verify the patient with their name or date of birth, or both. Introduce yourself to the patient. Ask questions relative to the exam. Ensure patient privacy and safety. And then also position the patient appropriately for the exam and or organ of interest. And you'll see most, if not all, of these key points demonstrated by my fellow Doppler divas, Taylor and Brianna.
Brianna? Can you just confirm your name and your date of birth for me, please?
Brianna Mancuso, 10/29/98.
Okay, great. Can you just lay in the bed for me on your back? Do you know why you're getting this exam today?
Just having some pain.
Okay, I'm sorry to hear that.
So today I'm going to be teaching you about the main portal vein. Last week we went over the Mickey sign and that did not go over too well. So hopefully today goes a little bit better. So the main portal vein is basically a major blood vessel that is formed from the confluence of the splenic vein and the superior mesenteric vein. At the level of porta hepatis, it brings in 75% of the liver's blood flow.
Usually to find the portal vein, techs will have the patient lay on their back or supine, or if needed, the patient will lay on their left side or left lateral cubitus.
The main portal vein is best found on ultrasound at the hilum of the liver, or best known as porta hepatis.
Brianna, we're rolling.
Oh, sorry. To find the main portal vein, we use a curvilinear transducer, typically between 2 to 5 megahertz.
All right, so first things first, we're going to turn the machine on and choose the abdomen package. Taylor's going to attempt to optimize her TGCs, but those, I would never do them that way. So now she's going to put some gel on the probe. That's a little bit of physics for you, but that's the only way that we can get the picture. But as for where we place the probe on the body, it's on the right side, sort of like an intercostal, transverse to oblique scan plane. We get everything in 2 scan planes, but I find that if you want to open up that portal, transverse oblique is the best way to go. And so now you could see it opening up beautifully there. We love that. But if you can't see it too well, or if people are really ribby, you could always move down a rib space, just like how she's doing there. So now she's going to put color on. We put color on just to check the blood flow and to make sure that the vessels are patent. There's no, thrombus in there. And to turn it in Sag, you tend to see more of the right and left branches and just like different areas of the portal throughout the right lobe. But that's pretty much it. Next time on Doppler Divas.
Joey!
No, you're acting. Joey! Stop, what's the way?
In the field of medical imaging, every shadow tells a story. In the medical system, diagnostic mysteries are investigated by 2 dedicated groups, the sonographers who capture the evidence and the radiologists who reveal the diagnosis. These are their images.
Hi everyone, we're doing an ultrasound liver scan today. Hope you enjoy.
Jennifer, get up now. It's gonna be right in here. You can have a seat on the table.
Take seat.
I'm gonna be your sonographer today, so if you could please just lay down and I'm gonna drape this over your abdomen. The liver is part of the right upper quadrant and it's in charge of metabolism, detoxification, and bioproduction. So basically, if the liver stops working, everything else starts panicking.
Honestly, this is one of the easiest scan drills because the liver is one of the largest organs. Just look at it, how big it is.
So if you can't find it, have the patient take a deep breath.
You got this!
For patient prep with a liver ultrasound exam, the patient should be NPO, which means nothing by mouth for 6 to 8 hours prior to the exam.
How did you get that? Because bowel gas is aggressive and never on our side. For the machine settings, we're going to be using the curvilinear transducer on the abdominal preset. As you can see, the image is really zoomed out, so we're going to decrease our depth and adjust our brightness, focus. All of these allow the image to be clear on the screen. Remember to hold the probe as close to the face as possible. I'm starting in a sagittal scan plane and asking the patient to take a deep breath to clear the image up. Please take a deep breath.
Taking a deep breath helps to clear up the image and get the ribs out of the way.
Textbook picture right there. Excellent.
Which honestly makes the scan 10 times better.
The liver is inferior to the diaphragm. Just look. To measure the liver, we start at the diaphragm to the end of the lobe. Beautiful. I'm proud of you.
A normal measurement for the liver should be 13 to 15.5 centimeters. A normal liver should be smooth, homogeneous, and slightly more echogenic than the renal cortex.
On to ergonomics. This is what we're not going to do. Make sure to sit up straight, remove your leg from the machine. Make sure to move the patient as close as possible so you don't hurt yourself. Make sure that your shoulder's at a 30-degree angle or less. In conclusion, the liver exam requires proper patient prep, anatomy knowledge, correct machine settings, and a solid scanning technique.
And while this may be the easiest scan drill, it's still an important exam that helps us produce diagnostic images.
Thank you guys for watching. Good luck on your next scan drill.
Remember ergonomics.
Oh my God! Okay, it's happening. Everybody stay calm. What's the procedure, everyone? What's the procedure? Stay calm! Wait. Everybody calm down! Oh my God!
Slay queen. Hey, baby.
Did we do like one of those?
Onto ergonomics. Onto ergonomics. Onto ergonomics.
Remember, every test is easy if you are prepared.
Hi guys, we're Jill and Tel.
And today we're going to be showing you how to scan the pancreas.
My name's Ashley.
My name is Kaylee. My name is Victoria.
My name's Katie. And I'm Juliana.
We'll be going over the anatomy of the pancreas, how to properly prepare and position the patient, the scanning techniques and key landmarks, as well as some normal and abnormal findings seen on ultrasound.
Okay, to best visualize the pancreas, the patient must be NPO 6 to 8 hours and the patient must be laying supine. Okay, proper patient prep is first, the sonographer must put on the glove. Okay, that's funny. Okay, then we have to drape the patient.
First, we want to introduce ourselves. My name is Victoria. I'm going to be your sonographer. What's your date of birth?
Juliana, 5/19/2003.
Perfect. Are you NPO for this exam?
Yes.
Perfect. Let's begin.
For the pancreas, we will be using the curvilinear probe, which we call the transducer, and choose abdomen. We will use the TGCs, which brighten or darken areas of the structure of the pancreas. We have the 2D, which is overall gain. We have the depth to increase or decrease the view of the image. We have the focus in case we need to focus more on the structure, and the zoom to zoom in.
When scanning the pancreas, we want to have our probe in transverse get a long image of the pancreas, like this.
And now we're going to show the anatomy of the pancreas. We have the uncinate process, the head, the neck, the body, and the tail. Now we're going to talk about the landmarks that we use when scanning the pancreas. We have the splenic vein, the SMA, the aorta, the IVC, the left renal vein, the main portal confluence, and the left lobe of the liver.
On ultrasound, a normal pancreas is going to have smooth borders and a uniform echo texture. Since the stomach is anterior to the pancreas, you can see that some bowel gas gets obstructed, which is shown here by the tail. So in conclusion,
I hope this video was helpful on scanning the pancreas. Here are some words of encouragement.
You got this.
Hi, we're the Spleen Queens.
And today we're going to be teaching you how to scan the
spleen.
I'm Heidi, I'm the radiologist.
I'm Tammy, and I'm the patient.
I'm Patty, and I'm the sonographer.
This is the spleen. The spleen is important because it filters blood, it is the largest lymph organ, it removes old red blood cells, and supports immune function. It is in the left upper quadrant of the abdomen, posterior to the stomach. Important features are the hilum, and it is normally 13 centimeters or less.
Okay, so to scan the spleen, you're gonna first start with picking the transducer. Pick the transducer and choose abdomen. This is the curvilinear probe, and make sure to have warm gel prepped for the patient. These are the buttons that you're going to be using. The main ones are going to be freeze. You're going to measure the spleen. You're also going to see any color flow through it. And yeah, that is practically the ones that you're going to focus on. And you're always going to optimize your image using the depth, focus, and zoom if you need to. Don't forget to always adjust the gains to adjust the brightness of the overall image, and the TGCs to adjust the brightness of the individual segments of the image.
Can you just confirm your name, date of birth?
It's Tammy Gordon, 2/6/2055.
All right. You are going to sweep through the spleen in a sagittal, meaning that the probe is going to be pointing towards the head of the patient. This is important to check for pathology and make sure that there's nothing wrong. You also want to scan the patient in transverse, meaning the notch of the probe is going to point towards the right. First image is length and sagittal. It should measure less than 13 centimeters. Check pleural space where fluid can collect. In transverse, you are going to get the image and measure the width. And lastly, add color to the splenic hilum.
And that is how you scan the spleen, brought to you by the Spleen Queens.
Spleen is evaluated in the left upper quadrant using intercostal scanning. Normal size is 13 centimeters or less. Proper patient positioning, breathing techniques, knobology, and ergonomics are essential for optimal imaging. I'm Heidi.
I'm Tammy. I'll say this.
I'm just burping, I'm sorry. Just confirm your name and date of birth.
Yep, it's Tammy Gordon, 2/6/2055.
Tammy?
Yeah.
Could you just confirm your name and date of birth? Stop looking at me!
First thing you should do when scanning a patient is introduce yourself and confirm their name and their date of birth.
Hi,
Hi, I'm Abby and we're doing your ultrasound today. Can you confirm your name and date of birth?
It's Gary Heckman, December 11th, 83.
The next step you're going to want to do is explain the procedure to the patient and ask them what brings them in today.
So, what brings you in today?
Painful periods.
Oh no, I'm sorry. We'll take a look at your uterus and see while that's happening. Did you fill your bladder before you came?
Yep, I drank 32 ounces.
Next step you're going to want to do is make sure you have the right probe. That one being the curvilinear one, aka the C1-6C2.
I don't remember. I think it was the curvilinear C16CTGYN. Now that the lights are off, we can begin our exam. So first you want to start off in a sagittal view of the uterus. So once you have the clearest image that you could get of your uterus with the endometrium in it, I'm going to show you guys how to measure now. Come. You're going to start by selecting the measure button and finding the thickest portion of the uterus, which is right up here. If you want to get a better view, you could always zoom in. Okay, then you're going to press measure and go from the outer edge to the outer edge. So our patient Gary's endometrium is measuring at about 0.67 centimeters.
Don't forget, Snug, first to ask your patient when the first day of their last menstrual period was.
So Gary, when was the first day of your last menstrual period?
Wednesday the 4th? Was that a Wednesday?
Sure. So our patient Gary is in the middle of their menstrual cycle right now, and they are in the late proliferative phase, which their endometrium looks perfectly normal to be in that phase.
So how does it look?
Actually, Gary, you're dying.
No! You can't say anything to the patient. You just tell them you have to wait for the results and the doctor will speak to you.
Are we done yet?
Yes, we are. You're all set. I'm going to send these images over to your doctor. You can clean up and use the bathroom and you're all set.
We can also measure the endometrium when doing a transvaginal approach with the TV probe. You will want the patient to empty their bladder prior to the exam and the patient to be in the lithotomy position. When you have the uterus in sagittal, you can measure the endometrium from leading edge to leading edge.
I'm Sarah.
I'm Carolina.
And we are ultrasound students.
Our group
name
is
the Thyroid Troopers.
Hi everyone. My group and I will be speaking about the CVD. It's such an important structure because it carries bile from the gallbladder to the duodenum and it helps digestion of fats. It's very important to evaluate your CVD because there could be abnormal findings which could explain any abdominal pain or jaundice.
Carolina? Yeah. Come on in.
And then,
Hi, I'm Megan. I'll be doing your ultrasound today.
Hi Megan.
Can you just confirm your name and date of birth for me?
Carolina Jimenez, September 19, 2003.
Perfect. All right, so you're going to have a seat on the table. All right, Carolina, what brings you in for this exam today?
I'm having some abdominal pain.
Abdominal pain? How long has that been going on for?
Like about 2 weeks now.
2 weeks? Okay. See if we can figure out what's going on. So I'm just gonna have you lift up your shirt. And we're just gonna put this drape on. And all right. And then for the exam, I'm just gonna be taking some warm gel, using the transducer to take some pictures, okay? All right, so I'm just gonna ask if you can move a little closer to me. All right, so some warm gel, and please let me know if I'm applying too much pressure at any point, okay?
To scan the CVD, we go to the right upper quadrant and find the porta hepatis by the ribs. Oblique scan plane pointing towards patient's right shoulder.
The main buttons we use when scanning the CVD are freeze, cine loop, calipers, depth, zoom, focus, gain, and color.
Can you show me where the CVD is?
Yeah, it's right there.
Where? I don't see it.
Right there.
The common bile duct is formed by the joining of the cystic duct and the common hepatic duct. The normal measurement is 1 to 6 millimeters, but can be up to 1 centimeter for those who have their gallbladder removed and for older patients.
The patient should be NPO for 6 to 8 hours to reduce bowel gas and improve visualization.
To visualize the CVD, we'll use a curvilinear transducer at 2 to 5 megahertz. You want to adjust the depth to include the porta hepatis, optimize the gain so the bile duct appears anechoic, and you always want to put color on to prove it's a CVD.
What were we starting again? We'll just start from and we are. Okay? Okay.
And we are. Oh, we have to do
3, 2, 1. Okay. 3, 2, 1.
And we are ultrasound students. And the thyroid.
Okay. 3, 2, 1.
Our group
name
is.
Okay. Ready? Give me a second.
Our group.
Okay. That looks really good there. Freeze and go back.
Yeah, just keep going back. Right there.
Okay.
There I go.
You're gonna do 3, 2, 1.
Hi, I'm Nicole. I'm Amanda. I'm Valerie.
We are the Gallbladder Gladiators.
Valerie Passanante, September 21st, 2004.
Alright. You can lay down. Have we had anything to eat today?
No.
Alright. And what's the reason for the exam?
I'm having some pain in like this right upper area here.
If I go from midline to find the gallbladder, I get quite a bit of artifact in there. If I go from an intercostal view and I find the gallbladder, can you just take a deep breath for me? Let's find it. And there's a lot less artifact in it. Have it in a long axis view. We want to turn into transverse to get that circle shape of it, and then we're going to measure the anterior wall. So you're just going to slowly turn your probe. You're going to measure that anterior wall right there. So sometimes when you're scanning the gallbladder, you might see a stone or a polyp. So it's very important that you have the patient go into the left lateral decubitus position. So can you just roll onto your left side for me? So if there are any stones, you should be able to see them. And this will help identify if the stones are mobile or if it's a polyp as well. The gallbladder, just ensure that you are seeing the neck, the body, the fundus, and look for those stones, look for those polyps if you see anything. And if you do see a stone or you do see a polyp, you are going to measure it.
So now that we found Valerie's gallbladder, I think it's important to state why is it so important. So what the gallbladder does, it helps regulate and store the flow of bile, which aids in digestion. So as we see in Valerie's gallbladder here, there are a couple distinct parts. So the fundus, body, and neck. And it's really important too, as we saw Amanda scan and sweep through the organ, we saw that there were no gallstones, which tend to be found in the neck and fundus of the gallbladder. So when Amanda was scanning, she made sure to get the gallbladder in sagittal, but also in the transverse plane, which is the best way to get the anterior wall measurement of the gallbladder.
So as I place the probe down, I see that it's a little bit shallow. So something we're gonna adjust here is the depth. So we're just going to go out, and then we can see deeper into the body here. And then this button right here is going to be the gains. So this is going to make the image brighter or darker. Another thing that affects the brightness of the image are going to be your time gain compensation knobs here, and that's going to adjust the brightness throughout different depths of the image. Here we have the gallbladder, but obviously this is not a great image, so I'm going to show you some knobology to make your image better. First of all, let's turn the gains down so you can see it without any artifact or anything. And then it's very far away, so we're going to adjust the depth and get nice and close. There we go. And then we're going to adjust the focus so that you can see it a little bit clearer. Yeah, there we go. It's a little bit better of a picture of the gallbladder. Okay. So when it comes to ergonomics, we don't want to do things like this, or like this, or like so you want to make sure you're comfortable when you're standing, so you can sit or you can stand, and you can lean on the patient to make sure you're comfortable. You can ask the patient to scooch a little bit closer, but you just want to make sure you're comfortable so that you're setting yourself up for success throughout your career.